Concierge medicine is a very big business, and it's gotten even bigger during the pandemic. Now some customers have a new request for their doctors, and you probably know what it is. Robert Frank joins us with more on that. Robert.
Hey, Andrew. Good morning. Well, concierge doctors were among the first to get rapid testing this summer. Now they hope to be among the first to get, yes, you guessed it, the vaccine. Now, concierge medical companies, that's where you pay anywhere from $3,000 to $20,000 a year for a private medical team and a lot of their services. They say business has more than doubled just during the pandemic as the wealthy seek that at-home care, the latest equipment, drug therapies. They were also among the first to get testing kits this spring and among the first to get rapid tests this summer amid a lot of controversy. Now, concierge doctors are getting flooded with calls from new and existing clients asking for early access to this vaccine. Now, the companies say they will follow all the rules of the CDC and the government, but they add they're working their connections with pharma companies, government agencies and advisors, distributors like McKesson, and a lot of the scientists that serve on their board and as advisors to see just how quickly they can get doses. Now, you know regulators are going to be watching this. The Medical Board of California investigated some concierge doctors back in March after reports that they were hoarding tests for healthy patients. So far on that case, there has been no finding of any wrongdoing. But guys, given the supply-demand imbalance of this vaccine in the coming months, you know that these wealthy patients are going to pay anything to get this vaccine. Back to you.
Okay, but here's the question, Robert. As some of our viewers who maybe have concierge doctors may know, most of the time it's an all-inclusive price. So you pay $7,500, $10,000 for the year, and that's supposed to cover everything. Do you think that there's going to be an add-on incremental fee just for the vaccine, and what do you think they would charge for that?
I don't necessarily think it's the business opportunity of an add-on. It's just that these concierge doctors, if you look at what happened with pricing, they were able, because of the money that they have, to lock up some of these labs that process tests, and they were able to get really quick results that most Americans couldn't get. So it's not so much there's an extra fee, it's that the wealth that these concierge doctors have and the money that they have from clients gives them access to people, to companies, to distributors that maybe some other regular doctors don't get. So it's a very wealthy industry. They're paying full for everything. They don't have to rely on insurance or wait for that. And I think that's the access that people worry about.
You know, Robert, just going back to like a freshman year economics class, everybody remembers the supply-demand dynamics and how if you don't let them play out, it can be a problem. And you just don't have to look any further than pulse pricing for Uber. You're either willing to pay up or you don't get the ride. But this is different. This is fundamentally different because there's no free market that can be, I don't think, really considered here. And the supply, we know what it is. It's de minimis initially. So it doesn't matter if you've got $50,000 to pay for a dose, but I'll bet you some people are able to do it, Robert. I'll bet you it does happen sometimes.
Well, and that's the whole point of this report. I think it will happen. I guarantee that in the next 3 to 6 months, we will hear some reports of whether it's through concierge doctors or some other means that people with the most money, and look to them, to the wealthy right now, there is nothing more important to spend your money on than trying to get this vaccine. So you know they're going to try, you know there's going to be a lot of money chasing it, and there will be examples of where they're able to get it. Now, how widespread, that remains to be seen. But you're right, it's supply, demand, and those with the most money, whether it's healthcare or any other part of the economy, they get it first.
Shepard Smith here. Thanks for watching CNBC on YouTube.